NHS app is going to become ChatGPT, but for healthcare. Let me explain. So the government's just dropped the new 10-year long-term plan for the NHS, and there's so many changes announced. One of the key priorities is making the NHS go from analog to digital. So within the NHS app, they're going to be introducing a whole bunch of new tools. The first one is My NHS GP, and this is the AI-based chatbot that's going to be able to ask you questions, answer back and forth, and then give you advice 24/7. And if it can't give you advice, then it will direct you to the appropriate services like your GP, 999. Then there's My Specialist, which will allow you to self-refer to different specialties like audiology, podiatry, MSK services, mental health, things like that. My Consult will allow you to message specialists directly, ask them specific questions, and get a response. My Medicines will tell you about your prescriptions, when to take them, and also tell you about any drug interactions based on your genetic profile. Interesting. My Vaccines will show you all your vaccination records, when you're due for vaccines. Then there's My Health. My Health will basically pull in data from different monitoring devices like glucose monitors, blood pressure cuffs, and things like that. And that will allow clinicians to track your health data in real time. There's My Children, which will basically become the new red book for kids. And you can input, your baby stats like height, weight, log feeding, sleeping pattern. My Carer will give authorized carers access to your records, and then they can do a lot of these things for you, like book appointments. And then finally, there's My Hospital. This looks more like a summary of you, so you can see when you're admitted, your test results, and so on. I believe they want to implement this over the next 5 years. It looks pretty ambitious, but I'd love to hear your thoughts in the comment section down below. Is it a load of waffle, or do you think this can actually be achieved?